Good morning, this is Dr. Timothy Scott Beck here at Life Point Medical. Life is good this morning for me, and I hope it is for you. But if it's not, and you feel like you're sick, come see us, okay? It's October the 13th of 2021. So look, I want to go ahead and give you some good advice this morning. Every week here in the office, I will see at least 2 to 3 patients who their biggest issue is they're just dehydrated. And I can tell when they're dehydrated because I usually will draw labs if somebody comes in there's like, I don't feel good, I don't feel right, something's going on with them. And then I look at the labs, and the labs, I have to do some interpretation of them, but most of the time I can tell whether or not you're adequately hydrated. I can tell by your concentration of your urine, I can tell by your kidney function stuff, and I can tell by your electrolytes if you've not drinking enough water. And a lot of those will give me telltale signs, and I put 2 or 3 of them together, and I'm like, okay, well, this patient probably needs more water. And I've harped on this in the past because I do think it's a significant preventive measure that you can do for yourself if you are sick, if you're ill. In other words, when you go to the hospital, when you go to the emergency room and you're sick, what's the first thing they do? They put an IV in you and start giving you water through your vein. Okay. When I put people in the hospital in the past, when I did that function, a lot of times what I would do is put them on water, and I'd manage it very carefully. And then a lot of times, if you're in the emergency room and the doctors are trying to decide whether or not you should go into the hospital or not, hydration is always a huge factor in that. In other words, if you get a patient who's a little sick, but they're really dehydrated, you have to be much more careful with them than if they're hydrated. So I think staying hydrated is an important thing to do. I think you can overdo it, so we'll talk about that a little bit. But what I recommend is around a quart of water in the morning and a quart of water at lunch to ensure that you are properly hydrated throughout the day. Notice I don't want a quart of water in the evening, okay, because I don't want everybody up all night using the bathroom, because that can cause other problems too, right? And I know there's things that limit people for drinking water. Like, for instance, I know that I think when you get older, water doesn't taste as good, okay? Number 2, I think if you have urinary incontinence, a lot of times people will not drink a lot of water because they don't want to have an accident and stuff like that. So I get all those things, okay? But I do know that if you're sick and if you're on medicine and you're dehydrated, your body does not work as effectively as it could if you're properly hydrated. And I know this because I've put lots of people in the hospital, and I think all we did was hydrate them and they got better and they got out of the hospital. So if you're sick, if you get this nasty cold thing going around, or the COVID-19 or whatever it is, go ahead and start drinking water. Go ahead and drink water. And the way you can tell, the best way you can tell whether you've drank enough water is to look at your urine. If your urine is yellow, like that kind of yellow, you probably need to drink more water. But if it's clear, then you're probably okay. So enough preaching for that. COVID-19, 2,063 cases. That's up quite significantly from yesterday, like 15. Again, we're still testing people. It seems to be a little bit more sporadic, okay, but this thing is still rocking our little community here. So just stay safe and keep protecting yourself while this variant makes its way around our community. Okay. Other than that, we're doing good today. Place of Hope is working out, doing their thing too. So if you want to go buy one of those bricks, we're still selling those, guys, and we've got the applications here in the office, and we will get you all set up for that if you'd like a brick. I've bought several bricks, and I think I need to buy a few more, but I'll get that taken care of here shortly. All right. If you need us, you give us a call. Otherwise, you have a great day, and it's always good talking to you.